second.
Okay, Mom. Okay, good. 1. Mom, I'm itchy and hungry.
Hi Naomi, welcome to the pharmacy. Haven't seen you in a while.
Hi, Iwei, good to see you again. I just picked up my kids from the childcare center. Timothy, greet the pharmacist.
Hi. My drawings. I get the
Wow.
best mark.
Impressive work. So is this yourself in the drawing?
Yes.
I see. Keep up the good work.
Thank you.
Okay, anyway, I'm the pharmacist on duty today, so how can I help you, Naomi?
Can I have something for head lice?
Head lice. So I'm going to take some moment to talk about the medication. Do you have time for it?
Yeah, sure.
Okay. So is this medication for yourself?
No, it's for my son, Timothy. There's been an outbreak of head lice in the childcare center which my kids attend.
Oh, I see. So hold on for a while. I will get the medical notes for Timothy.
Okay.
Okay. So can you describe more about the symptoms found in Timothy?
Oh, he has been scratching his hair persistently.
My hair still very itchy.
Okay, what about any specific symptoms like severe itching of the scalp? Or maybe did you witness any red bumps on the scalp or back of the neck? Or any lice or nits found on the scalp?
I'm not sure about it. Can you help me to inspect his head?
Okay, sure, no problem. So, Timothy, is it okay if I inspect your hair?
No.
Why? What's wrong? Why are you upset about it?
All my friends laugh that I have dirty hair.
Not to worry. Having head lice doesn't mean that you have dirty hair. So, don't be worried. I'll inspect on your hair. Is it okay? Not to worry. It's just checking. Alright?
Alright.
Okay. So, Naomi, just to let you know, head lice are usually found behind the ears and also at the back of the neck. So these are the regions people usually check for. So let me have a look at this. Okay. So from my observation, I actually saw several live lice on Timothy's hair.
Oh, really?
Mom, what are nice?
Okay, Timothy, just to let you know, lice are actually brown, wingless bugs which are found crawling on your hair, your skin, and also your clothing.
It sounds scary. How did I get them?
Not to worry, it's actually very common among children. And just to let you know, you actually got this from head-to-head contact. Did you play with any kids in the childcare center?
Yes, I have a lot of friends.
You will actually get head lice if you share items which involve touching your head, for instance, your comb, caps, and also accessories. And or else, if there are any children with head lice, they lie on the sofa and you went and touch the sofa or any beds, you will also obtain head lice from these sources. Has Timothy had anything like this before?
No, this is the first time.
I see, so it's your first encounter. How long has he had this symptom for?
Just recently, about 1 week ago.
Has he tried anything to treat the head lice yet?
No, I have no idea how to deal with it.
Okay, not to worry. Does Timothy have any other medical conditions?
No, he's in a healthy condition.
I see, good. So just a few quick questions. Is he on any prescription medications?
No.
Okay. Over-the-counter medications?
No.
Supplementary medicine?
No.
Okay. Is he allergic to anything?
Not that I'm aware of.
Okay. So let me summarize Timothy's condition for you. So he has been scratching his hair for about a week, and then he's not taking any medication, and he's not allergic to anything. Am I right?
Yes.
Alright. So please hold on for a moment. I'll get the medication for you.
Okay, wait, just now I saw there's many products for head lice. So what product would you recommend?
That's a very good question because there are a lot of anti-head lice products in the market right now. So I've chosen one which is suitable for Timothy as he is a child. So not to worry because all these anti-head lice treatment are very effective and simple to use. So you don't have to worry much about it. It's simple to treat. And it sounds to me that Timothy is actually encountering a head lice attack. Okay? So do you have a few minutes? I will talk to you about the medication and also how to use it.
Okay.
Okay. So this is the malathion lotion. So inside there's actually 30 ml of the anti-head lice product. So this is an anti-parasite and antifungal, suitable for children more than 2 months of age. Okay? So it's definitely safe for Timothy, not to worry. And so far, this is the most common and effective way of treating head lice.
So how do I use this medication?
Okay, the good thing is that this product actually comes with a lice comb, so you can use it together with the lotion. I'll teach you the simple steps of using this anti-head lice treatment. So just 5 steps you can complete this treatment. So the first one is dress. Very simple, just get Timothy dressed up. Make sure to cover all his skin portion, and also place a towel at the around the neck. Okay, next you apply the lotion for 10 minutes all over the scalp.
Start with the scalp and work the treatment outward. Pay attention to behind the ears and the nape of the neck, where lice and nits are more likely to be found. Next, she's going to comb out those nits.
And then third, you just let it dry.
Can I use hair dryer?
No, it's not recommended because there are flammable materials in the lotion itself.
Oh, I see.
Right?
Okay.
Then fourth step, you just have to rinse it, okay, using water. Very simple step.
Oh.
And the last step is to repeat all this step after 10 days, because nits will actually hatch after 10 days and you want to kill them.
Oh, it is really simple and easy.
Yes, so if the treatment is working, you can wait for 2 days and make sure not to wash his hair using any other shampoos so that the medicated product can stay on his scalp for a longer time.
Okay, any precaution?
That's a very good question. It's very important not to use this lotion on broken skin or touching the eye area because it's really sensitive.
Oh,
So if you accidentally do so, just use water to rinse it for about a few minutes. So you might not need more than this supply. In case you need more, you can always come back.
Oh, okay. Is there any side effects?
Not to worry, these are very minor and temporary side effects. So after using the lotion, he might experience very minor skin irritation, redness and rashes. So some people, they might even get dry hair, and also there's a stinging feeling on the skin.
It's so Iwei, when do I stop using this?
So you should stop using it once the head lice is removed. So you can expect to see improvement in at least 2 treatments, and this will take you about 2 weeks. So if let's say you see no improvement, you can either come back to the pharmacy or I'll recommend you to visit a dermatologist. So Naomi, do you have a clear understanding of how to use the malathion lotion?
Yes.
Okay, good. So can you briefly summarize the 5 steps on how to use this lotion?
Okay, sure. First, dress, apply, dry, rinse, and then repeat.
All correct. Just 5 simple steps and you're done. Here are some tips and advice on lifestyle changes to prevent any head lice from being present in your family in the future. It's always good to constantly check on your child's hair for any head lice using a lice comb. And also, if let's say any members in the family has head lice, it's very important to check other household members who has close contact with him or her, because it's easily transmitted by head-to-head contact.
Oh, I have another child, so can I bring her here for you to inspect?
Yeah, sure, no problem.
Oh, okay.
Hi, Sarah. So is this your youngest daughter?
Yeah, she's 4 years old.
I see, that's a very cute girl. So usually for girls with long hair, it's even more important to check their hair, and it involves parting up the hair and also clipping it up when you check. So you have to check near the scalp. So let me just have a look first. Not to worry, there's no louse found on Sarah's hair. So another tip is to avoid sharing comb among all the children in your house. So this is your malathion lotion, and I will give you a patient information leaflet for you to know more about head lice.
Oh.
Okay, so the brand name is Lice. You just wash for 10 minutes. So it easily kills lice and eggs, and it's easy, fast, safe and effective to use. So do you have any other questions, Naomi?
No.
Okay, good. So I hope Timothy will recover soon, and thank you for your time.
Okay, thank
Good
you so
luck.
much, Ewei.
Okay, bye.
Bye.
Have a nice day.
Okay.
Yeah, finally can go for lunch.
Sir, drop your weapon, put your hands on your head, and get down on the ground.
Head lice wanted.